Okay, so this exercise is going to look at the coordination of the lower body and the upper body together, cross brain patterning skills, and breathing at the same time if you can. So we're going to do our knee drops and we're going to do our flies in the upper body. So first of all, you're just going to find yourself in a nice comfortable position, however that looks for you, with your number of head cushions to get you nice and comfy. Find, of course, that neutral pelvis. So if you need to, do a few wee tilts forwards and backwards. Find that nice position. And then remember when we're doing these knee drops that the pelvis is going to stay completely steady and that you're actually going to focus on the leg that's not moving. So I'm only going to let one knee move out to the outside and that foot is just going to roll onto its edge. And how far I go depends here on the amount of control I have on this other side. So I stop this knee dropping whenever I lose control. Either this hip starts to follow that knee or that knee starts to counterbalance. Okay, so we're going to come back up again and do the same on the other side. Just going to let the knee open, focusing on this side. So from your angle, you shouldn't see any movement on that leg at all. I'm just going to keep going, breathing out as I open. Breathing in to come back. And I've just got my hands on my hips here just to help me feel a reaction if there is any. And that also gives me a little bit of feedback knowing that my end range of movement has been reached. Okay, so that's your knee drop. It's not fast. It's a nice gentle controlled opening. Because if you go too fast, it helps, or it struggles to keep the other side nice and steady, because it will just pull it here. There's no reaction, there's no control. So just keep it nice and steady, nice and focused. So that's your knee drop. Your flies then, remember, is the upper body exercise. You're creating that little hug, fingertips together, elbows nice and open and wide. And we're going to start off doing both arms. So you can pull back through the shoulder blades and then push forward again, the fingertips together. You're going to breathe out as you go out, and in as you come back in again. As you open again, we're just looking for control here of the ribs. So as we pull the elbows back, we're not lifting the chest. So just keep that nice connection down through the front of the body. And just enjoying that movement and that nice stretch through the shoulders as you open and close. Once you do a few of those, then change to one arm flies. So one arm is going to stay where it is, and one arm opens up and closes. And then you're going to alternate that. So the other arm opens and closes. Again, we breathe out as the arm goes out, in as the arm comes in. Good. And then just evening up, and finish with the left. Okay, so that is the knee drop on its own, and then the flies, the arm movement on its own. So now what we're going to try and do is challenge this coordination of our body. So we're going to try and put them together. So at the minute, I'm going to try opposites. So as one knee opens, the opposite arm opens. And then we're going to close both together at the same time. And then we're going to swap sides. Breathing out as I go out, breathing in as I come in. Now this is where your control will possibly go to pot. Because what you're looking for here is that the same movement happens and the same non-movement happens, if that makes sense. So as the knee opens, you're still looking for control through the opposite side. And sometimes you'll find when you're concentrating on this too much that everything just opens and everything goes at once. So if you struggle with coordination, what you can do is let one knee open first and then add in the arm. Yes, you get a little bit of a chance to think about it. But if you can, try and open both at the same time and try and return both at the same time. But that's a progression if you struggle, yeah? Once you get the opposites going, then what you want to try and do is do the same side. So it's both right arm and right leg open at the same time, back in at the same time, and then the same on the other side. Now what you'll find with this one is that when everything opens to the same side, it's quite heavy, so you're actually going to need a lot more work on your opposite side to stop everything following and tilting and reacting to that opening side. So lots more work down through here and the back of the ribs as you let one side open. Yeah, so you've done opposites, you've done same sides. Play around with that a little bit until you can actually breathe and keep that nice control. And then once you get that, you want to try and be able to swap. So if I'm moving here on the same side, I want to be able to change to the opposite side. And if I do opposites for a few, out as I go out, in as I go in, then I'm going to try and swap again back to same sides. And it's just a matter of playing around with that until you get comfortable. But get the control and the movement first, the legs and arms on their own, join them together, and then have a play. Have a play with that coordination, see if you can get it to work. Hope you enjoy it, and I'm looking forward to seeing lots of changes and improvements when you get back. Thank you.